Hello and welcome to Lesson 4 of Section 1. You've made it this far. Congratulations. If you've come to this course, you have a pretty good idea that mindfulness is good for you, and it is. Because of its benefits, it's been used in corporations, hospitals, and schools. It's even been the focus of a special issue of Time magazine. Let's face it, we're all busy. I'm busy, and I'm pretty sure you are too. If we're going to add something to our schedule, if we're going to take time to practice something new, we need to have a pretty good understanding that we're really going to benefit from it. We need to know that there's a purpose, and we need to understand that purpose. And that's what this lesson is about. Today I'm going to share with you some research about mindfulness, and I'm also just going to talk to you about some benefits that have been observed by, well, a lot of people. So let's get started, and I'm pretty sure that this is going to boost your motivation to start practicing. So as I've said, if we're going to add something to our day, we need to have a very good idea of why we're doing it. A great example of this is physical exercise. We all know that exercise is good for us. There have been many, many years of research as well as just our own experience to validate this. Knowing this makes it more likely that we'll go to the gym or make an effort to incorporate exercise into our routine. The doctor has told us we need to exercise in order to be healthy, and we're pretty convinced of this. I want you to have a similar relationship with mindfulness, but perhaps even a better relationship. Mindfulness has an advantage in that it's free of charge and you don't have to leave your house. Also, there's less chance of injury. I'll present some research findings, but first I want to talk about something called anecdotal evidence. Anecdotal evidence is collected informally, and it's shared through personal testimony. It's basically what we think of when we hear word of mouth. So if your friend says, "Hey, I've tried this thing called mindfulness, and wow, it's given me some really great benefits, I think you should try it," you're probably going to be a lot more likely to try it out. So the following is going to be a list of benefits that I've experienced, that people in my meditation groups have experienced, and that my clients have experienced. They feel they can better handle their emotions. They tend to feel a lot less stressed. They're able to let things go much more easily. And they don't get so caught up in worries and negative thinking. Beyond these amazing benefits, there are also some long-term rewards that are not always mentioned. These rewards improve our quality of life. They free us to be our best selves. Mindfulness provides more clarity for us to live intentionally and to pursue goals. It also helps us to be more compassionate and open in our relationships with others. It helps us to be more flexible in responding to challenges in our lives. And it also helps us to be able to experience joy more fully. Much of the anecdotal evidence that we might hear about comes from celebrities like musicians, athletes, and top executives. Oprah, Ariana Huffington, Kobe Bryant, Paul McCartney, Richard Branson, and many others use meditation as part of their daily routine. Oprah found it so helpful that she developed a meditation program for her employees, and she's actually quoted as saying, "The results have been awesome. Better sleep, improved relationship with spouses, children, co-workers. Some people who once suffered migraines don't anymore. Greater productivity and creativity all around." I'm not mentioning this here because I think we should all follow celebrities, but these people have experienced and they know that mindfulness can support the success that they have in their lives. And this can benefit all of us, even those who aren't celebrities or CEOs. Like me, most people feel more confident when claims are backed up by scientific evidence. The good news is that the evidence for mindfulness is growing. Much of the word of mouth benefits have been supported through the research. But what's more is that there are many findings that are turning up more fascinating information that we didn't even know about. It's creating a quite compelling case for why we should practice mindfulness and make it a part of our lives. Right now, I'm going to go through a list of the research that I find most compelling. As this chart shows, the first research articles were published in the 1970s, and in 2000 there were only about 20 publications. This number rose rapidly to 350 in the year 2010 and to well over 1,000 in 2017. Now, I don't think this would have been the case if mindfulness was just a passing fad in the self-help field. We'll know much more quite soon, but I want to share some highlights of what we do know now. Let's start by looking at something that might be most obvious related to meditation: attention. Mindfulness has been shown to strengthen our ability to focus on one thing and ignore distractions. This is called selective attention. One study that found this relationship looked at the ability to focus on foot taps, and another measured how well participants could differentiate between different types of sounds. Those who had mindfulness training were much better at these tasks than the control groups. This makes sense, as mindfulness does give our brain practice focusing on one thing. As in a lot of other things, we practice and we get better. Mindfulness has also been shown to improve cognitive control, or the ability to focus on a task and ignore distractions. Researchers at the University of California, Santa Barbara found that a 2-week course on mindful breathing, paired with other mindfulness tasks, resulted in improved concentration and working memory. The most impressive finding was that the mindfully trained group improved their graduate school entrance exam score by up to 30%. The people who reported that they were heavy multitaskers seemed to actually have the most improvement after mindfulness training. This bodes well for even the least mindful of us. So we've seen that mindfulness, as we expect, helps us to get better at focusing. But how does this happen? Well, we're not entirely sure, but there are some clues. Remember the default mode network? The network activated during mind wandering? It appears that mindfulness could help us to get better at focusing by quieting the default mode network, making it less active. Research has suggested that the link between parts of the frontal cortex and the default mode network is strengthened in long-term meditators, suggesting they have more control over quieting the wandering mind. In other words, the cortex was better able to tell the default mode network to be quiet so it can focus. But why might this be beneficial? There's strong indication that mind wandering is connected to being unhappy. In a well-known study from Harvard in 2010, it was concluded that people reported being less happy when they were in the mind-wandering mode. They discovered this by using an app that allowed people to report on what they were doing and how they were feeling throughout the day. The researchers concluded that the ability to think about what isn't happening is an adaptive achievement of human beings, but that it comes with an emotional cost. It appears that when we turn off the default mode and quiet these thoughts, we're likely to feel some relief. And I'm guessing this may also free us up to enjoy the moments of our lives. One thing that's helped us to study mindfulness is the development of structured training programs. John Kabat-Zinn, who I mentioned earlier, was a pioneer in developing these programs. What he did was take the most potent aspects of mindfulness and apply it in a medical setting. He developed an 8-week course called Mindfulness-Based Stress Reduction. What this did was create a type of training that could be replicated for the use in different studies. Now, originally, he developed this in a hospital setting to help patients who were suffering from chronic pain and from long-term serious illnesses. And he discovered that this could actually help people to deal better with their pain. So let's look at some results in which MBSR training was used. In a 2014 study, 109 patients with chronic pain were randomly sorted into either an MBSR training program or a waiting list control group. The researchers measured pain, physical function, mental function, pain acceptance, and quality of life over a 2.5-year period. As anticipated, the researchers found that those who went through the training were significantly better at accepting and managing chronic pain. What this and other studies tell us is not that mindfulness training removes the pain, but that it changes the way we can respond to it and improves our quality of life. We still hurt, but we're less consumed by and less bothered by our pain. Mindfulness training has also been shown to improve the functioning of the immune system. A well-known 2003 study focused on how mindfulness training affected people's brains and immune systems. This investigation revealed areas of increased activation in a region of the brain that was connected to positive emotion, as well as evidence that the immune system reacted more strongly in producing antibodies after meditation training. Now, I think that this makes intuitive sense, given the relationship between mindfulness and stress. As we know, stress decreases immune functioning, and mindfulness helps us to better manage stress. We're less likely to get sick when we get better at managing stress. What's interested me the most are some more recent studies looking at how magnetic resonance imaging can be used to show how meditation practice can change the physical structure of our brain. These studies have shown that people who regularly practice mindfulness have changes in their brains and that they differ from those who do not practice mindfulness. These changes are positively correlated with improved mental functioning and well-being. The results of these studies are in line with something called neuroplasticity. Neuroplasticity means that with training and repetition of certain skills, structures in the brain can actually change in size and form. For instance, violinists have been shown to have an increase in the size of parts of the brain that are involved in their musical skills. As it appears, the same holds true when we practice mindfulness. This is exciting and encouraging because we now know that all of our bad habits have not ruined our brains. We can start changing our brains with each moment of practice. Dr. Sarah Lazar, a researcher at Harvard, has focused on studies looking at the effects of meditation on neuroplasticity. The results of her study, published in Neuro Report in 2005, showed thicker areas in the cortex that are related to attention and sensory processing in long-term meditation practitioners compared to those who did not meditate. These findings from Sarah Lazar, some of the first highlighting how mindfulness can impact the brain, also revealed the amazing finding that meditation practice may slow the shrinking of parts of our brain caused by aging. Other studies have also found this potential impact of mindfulness training on the aging brain. For example, results from a UCLA study showed slowing in brain shrinkage for long-term meditators. At age 50, their brains were an average of 7.5 years younger than those who did not meditate. Dr. Lazar's fascinating research turned up even more conclusions that surprised many of her colleagues. Compared to a control group, there was an increase in the size of the hippocampus among the meditators. This is a big deal because the hippocampus is important in learning, memory, and the regulation of emotions. It's also one of the first regions to start degenerating in Alzheimer's disease, and a smaller hippocampus is seen in people with severe clinical depression and post-traumatic stress disorder. Maybe this is one way in which meditation improves our abilities in key areas and lessens the impact of depression and other mental illnesses. It's always important for results to be repeated by other researchers. This holds true for Lazar's work, and that additional researchers have found similar results. For instance, researchers from Canada and Germany reviewed and analyzed 21 studies that looked at changes in the brain structure of people trained in meditation. They found meditation is consistently associated with changes in 8 brain regions. These 8 regions include areas that are key to introspection and awareness, body awareness, memory consolidation, self-control, emotion regulation, and communication within and between brain hemispheres. All of these are important aspects of mental health and well-being. But what does research tell us about the effects of mindfulness training on problems like anxiety and depression, the problems that bring people to come and see me? Well, a recent study by the Journal of the American Medical Association that reviewed a number of other studies concluded that mindfulness training could lessen anxiety, depression, and chronic pain about as much as medication, but without the side effects. This is encouraging, and this highlights the need to bring mindfulness training in to the psychological and medical treatment of people who are suffering. There's very encouraging data for the results of mindfulness training with people who suffer from chronic depression. A group of researchers out of England and Canada found that a therapy developed for depressed patients, mindfulness-based cognitive therapy, reduced the rate of future episodes in depressed patients by half, even slightly more so than any medication. In a follow-up study done by Mark Williams at Oxford, a 2016 meta-analysis of 1,258 total patients concluded that mindfulness-based cognitive therapy was an effective way to lower relapse of severe depression. The more severe, the larger the benefits. And in fact, the more time these patients put mindfulness into practice, the lower their chances of having another episode of depression. So I've met with a lot of people over the years, and they ask me about medication. A lot of times they want a simple answer. Yes, they should be on medication, or no, they shouldn't. And it's not a simple relationship. Many people who I've talked to are simply not comfortable relying on medication to manage their moods. However, there are certain people who have very severe ongoing depression and anxiety that impacts their functioning on a daily basis. And in these cases, oftentimes medication can be helpful. But the problem is if we rely too heavily on medication. If people turn to medication as a way of dealing with their emotions without learning other ways of dealing with them. And I think this is one reason why mindfulness is so exciting, because mindfulness can allow us to be with our moods, to be with our emotions in a more free way, a way in which we don't have to rely on buying medications and dealing with a lot of the difficult side effects that come with the medications. I think people also feel better and more empowered knowing that they can actually learn tools to manage their moods. And so this is, again, a very important piece of information about why I think mindfulness is so beneficial, especially in today's culture. Mindfulness has also shown promise in treating addictions, which are clearly a great source of pain and suffering in our world. Judson Brewer developed a program that taught mindfulness to smokers. The results of his research suggested that these smokers quit at twice the rate as those who were assigned to a group that were given the previous treatment of choice from the American Lung Association. Brewer concluded that learning mindfulness allowed the smokers to change the link between having a craving to smoke and actually smoking. If mindfulness can help us manage cravings and engage in fewer harmful habits, that would clearly have an enormous benefit for individuals, families, and society. Others have found mindfulness to be an effective tool in treating addictions. Researchers in Washington and New Mexico compared 3 interventions: a traditional relapse prevention program, a 12-step program like AA, and an intervention that integrates mindfulness practice and relapse prevention. 12 months later, the program that combined mindfulness practice and relapse prevention was the most successful in sustaining a reduction in drug use and heavy drinking. These results suggest that mindfulness brings something above and beyond our traditional ways of treating addiction. But this could apply to all kinds of addictions and cravings, and I'll say more about this when I talk about habits. I want to close out this lesson by looking at some cutting-edge research that shows how mindfulness can actually impact our genetics. First of all, it's been shown a connection between mindfulness training and a reduction in inflammatory genes. Now, these inflammatory genes are involved in things like aging and cancer. Now, that's pretty cool, but there's some other stuff that I find even more fascinating. This involves the telomere. And ladies and gentlemen, if you're not already familiar with it, let me introduce our friend, the telomere. This is a picture of a chromosome with telomeres on the ends. Telomeres are like caps on the ends of chromosomes. You might imagine them as similar to caps on the end of shoelaces. They're important because they protect the chromosome from deteriorating. Over time, as we age and due to cell division, the telomere ends become shorter. Now, aside from being caused by aging, shortened telomeres have also been seen in cases of childhood trauma and cancer. However, telomeres are replenished by the enzyme telomerase. Recent research has shown that mindfulness practice can increase telomerase activity, which seems to slow down the process of cell death. A group of regular long-term meditators were shown to have significantly longer telomeres than similar individuals who did not practice mindfulness. This seems to fit with other data that we've discussed, as mindfulness is associated with lower levels of stress, depression, and anxiety. Stress, depression, and anxiety are all likely connected with increased levels of cortisol, which can negatively impact our telomeres. This is by no means meant to be an exhaustive review of the evidence for mindfulness. If you want to know more, please take a look for yourself. But also keep in mind that this is still a fairly new area of research, and scientists are continually honing their ability to measure the impacts of mindfulness. So why is all this important? Why did I cover all this information? Well, because the results of these studies have shown that mindfulness can change our brains, and I believe in the power of human change. Now, it may take some time for you to notice the impact of mindfulness for yourself. You may start to notice some subtle changes, and you might notice a lot of the things that I covered in today's lesson. Some of these might be less obvious, and it may take more time to see them. You know what? I really don't think that you'll be able to notice a change in your telomeres, but it might be happening without your noticing. So what I want you to do is continue to practice, because as you practice, things are happening that are outside of your awareness. Really cool things. So what I think is that with practice, old pathways can change and new pathways can be forged. That's all for today's lesson, and I'll see you next week.